Welcome to Whitman Partners Perioperative Powerless Series for 2022. Today we have Claudine Hoppen, who is the Vice President of Surgical Services for Henry Ford Health System. Claudine, thank you so much for joining us. I appreciate you taking out time from your busy day, obviously, to talk with us and to just kind of share with your peers what your job is like and for people to learn that might want to aspire to your position.
Absolutely. Thank you for inviting me.
You're welcome. So my first question is, is there an event or an opportunity that kind of launched your career to executive leadership?
It's actually a good question, and I can't really pinpoint it down to a one single event in my past. It was really more along the lines of not seeing a reasonable representation of clinically focused female leaders at the top of the healthcare industry. This has evolved over the years and seems to be improving, but we're not quite there yet. I had really a strong clinical background as a pediatric nurse anesthetist for 18 years. And I really think it was kind of the desire to contribute from both a clinically focused perspective and an operations perspective that was really my primary driving force.
Cool. What is your approach to streamlining initiatives across multiple sites? And I'll merge this question with another question I had about prioritizing resources across systems, especially during COVID surges. What is that process like?
So, it's interesting. It's healthcare institutions are the vast majority are so highly matrixed right now. That developing a shared commitment and a tangible vision for any process improvement initiative or change management is absolutely critical right at the inception of a project. I firmly believe it really can't be an autocratic approach. You have to, if anything is going to work to drive change in healthcare, you really have to have the buy-in and know the why, not only from senior leadership, but it really has to come from significant swaths of the frontline leadership as well. After embarking on two supply chain management initiatives at different academic institutions that were aimed to standardize and consolidate supplies that are on preference cards, having that level of shared ownership and clinical expertise from surgeon champions and from nurses and techs in the room has been absolutely critical. It's certainly not to say that any of these important initiatives or change management won't encounter obstacles. It will every single time that you embark on these, especially when you're trying to pivot across multiple institutions. But it really requires kind of that constant level of vigilance and constantly going back, drilling into the data and doing, PDCA cycles. And really, if the results aren't working, having the dexterity to pivot and say, okay, hey, this isn't working. We've got to take a step back and revise. So a lot of that comes from the data, and a lot of it comes from really learning how to listen and take feedback.
Mm-hmm. Yeah, that makes sense. What have been some strategies that your system has implemented to deal with staffing shortages, burnout? A lot of these issues obviously were present before COVID, and COVID has made them worse. How has your system handled this?
So you actually made a very, very good point. The great resignation that has been seen, across our nation for the past year and a half has been particularly troublesome in healthcare. Prior to the pandemic, I think we knew that we were going to be encountering a nursing shortage across the US. We had an aging workforce. Um, and we also had a very limited pipeline of surgical technologists that were feeding the hospitals. The pandemic just kind of threw jet fuel onto all of this, right? It accelerated resignations, it accelerated retirements. It certainly contributed to burnout, especially amongst inpatient nurses. Um, and so how do you attack that? Because it's a big, it's a huge problem. And it really is it's a national crisis at this point. Um, Aside from ensuring that human resources has maintained payroll equity, I think we have to figure out a way to develop better incentive plans for our staff. I'm not entirely in favor of critical pay, of slapping critical pay onto everything, because it can go on in perpetuity. It doesn't mean good financial stewardship for the system. But instead, we need to find incentive programs that will naturally wean themselves off as we take the time to onboard more staff and get them through orientation. And I think we also have to find more creative ways to incentivize staff. Very often, especially with younger generations, it may not be the sheer financial remuneration that they are looking for. They're looking for some type of work-life balance, and we've missed that. And that is, one of the things I think moving forward that we need to look at. Would they rather have more PTO time? How can we flex their schedules? There are creative solutions that we had many, many, many years ago, back even when I was an ICU nurse, that you had weekend cadre. Bringing those perhaps older concepts back into play is what we're going to have to do to get through this crisis.
Yeah, my mother was an LPN for many years, and I was talking to her a couple weeks back, and she was saying how back then people would have, it was like instead of 12-hour shifts, it was like 8-hour shifts.
Yeah.
Like I think she said 3/8. And so it was a little bit more predictable. It wasn't as intense. And then if you took on an extra shift, it may not be as bad as taking on 2 12s versus 2/8s.
Right.
Things like
Exactly.
that.
Yeah. Weekend cadre was this fabulous concept. The staff worked, I think, they did a 12 on Saturday, a 12 on Sunday, and maybe they did like an 8 on a Friday or a Monday, however it was structured. But they were able to plan their lives around that. And if you, if you didn't want to have to support childcare, if you had someone that could watch, your child for you on a weekend, it really gave them that work-life balance. And we got away from that, and we've got away from some of those creative staffing models that I think we need to start digging back in and dusting off.
Yeah, I totally agree. How are you guys dealing with the travel nurse competition? I guess demand has like gone through the roof, right? How are you guys? Obviously you can't force someone to stay if they want to go travel, but how do you make staying, at least make them or help them reconsider going to travel?
So I think what you made a very good point. We call it travel. And so years ago, it was if you joined a travel agency, travel actually meant what travel actually is. And that meant that you traveled. That disappeared in the pandemic. And what has happened is it's turned into an enticing endeavor for many nurses and techs. It's extraordinarily difficult on the staff that are left behind when their colleagues who are working side by side on a Monday, and the following Monday, they again are working side by side, only they are making double what the staff that are left behind are making. So, obviously you have to make sure your human resource colleagues are in lockstep with you, and have that business partnership, just to make sure that you have market equity for all of your staff. Again, work-life balance, has to be addressed. But we have to hold travel agencies to exactly what they are, and that is travel. So really what needs to happen long-term is we need support from legislators in all of the states to really mandate somewhat. If you are going to join a travel agency, that means travel outside of a set mile radius or outside of the state in which you reside. Because what we are doing with this is we are irreparably driving up the cost of care. And it may be a temporary thing, but we are unnecessarily driving up the costs of care. And it's not going to be sustainable long-term for any of us. So I think that would truly help limit or curb back some of the travel agencies that we see. We know that they actively recruit, and that's perfectly fine. It is a free market, but we have to be able to put up internal controls and guardrails. And right now, they just aren't. They don't exist.
So some people are taking travel assignments, but they're not actually leaving their state or even leaving their city.
Oh no, they're not leaving. Some are just going a couple miles down the road to another hospital.
Yeah, that's
a problem.
crazy. That is a problem.
That's a problem.
To say the least.
That's where we need to get some guardrails up to really be able to protect, insulate, and care for the staff that have not joined travel agencies and that we want to retain and support.
Mm-hmm. So you mentioned, work-life balance, finding creative ways to incentivize people to stay. What are your thoughts on how to approach just like team morale? Even if you have all of those things in place, some days are going to just be not good or just stressful or awful. Like, how do you handle just morale on those bad days?
So it's interesting in the position that I'm in right now. I don't have the good fortune, to be at every single site every single day, and I'm not with the frontline staff as much. But this is where leadership visibility comes in. And this is where we really need those that are on site at the hospitals, your OR directors, your OR managers, your VPs of operations or COOs, to really have active rounding, active listening sessions, sit down with the staff. That goes a long way to the staff feeling like they are heard, seen, and appreciated.
And would you say that is the bridge between administration and staff, is to just be visible and to actively say, hey, you can talk to me. Sometimes it's hard for staff to even approach leadership. So do you think it's really advantageous for leadership to say, hey, I'm here?
I think it's leadership approaching staff.
Yeah.
It's leadership in scrubs, in the ORs. How are you doing? What are your challenges? And how can I make them better? You'll learn a ton that way.
Yeah. How, if at all, has the pandemic changed your leadership style, you think? Are there any things that you think about differently or do differently now than you did pre-COVID?
I think so. I think something positive always emerges out of adversity. And the situation that we're in right now is no different. All leaders have really had to learn how to leverage different staffing models over the pandemic. You've learned the creative use of existing space to care for COVID patients versus non-COVID patients. And all of this resiliency and creativity, I think, has really started to breed better leaders. Tired leaders right now, but better. And if I had to narrow it down, I'd say that as a leader, I've probably learned how to step back and start to think of how can you redesign, right? How can you take a problem or take a situation and become more productive with it? Um, how can you engage different skill sets um, that you didn't think you had prior to the pandemic? You had really just never had to reach that deep to become that creative.
Yeah, I think creativity, intuition, like all these things, it's like you have to really think outside of the box. And it sounds kind of like, uh, I don't know, we say that term a lot, but it's like
Yeah.
so relevant.
Yeah. You know, converting recovery rooms into COVID units, changing the entire staffing model of an ICU and a step down unit. So that you could leverage the use of better leverage your limited supply of critical care nurses. It's all been, I think it's all been a learning process, and I think in a way we're better for it right now.
Mm-hmm. For someone in your position, how do you leverage, or I'm sorry, how do you balance visibility for yourself in terms of people, when people see your face? How do you make sure people know who you are and that they know that you're there? How do you do that?
I would actually say this could be one of the benefits that emerged out of the pandemic as well. Years ago, I think if you asked me, could you reach all of your employees and sites and leaders electronically, I would have said absolutely not. There's how could you do that? You have to be, physically present. I think the pandemic has forced everyone in healthcare to leverage technology better than we ever have in the past. From, video visits to leveraging technology platforms, Teams, Zoom, WebEx. Um, that is what has really kind of revolutionized our ability to keep moving forward.
Yeah, so true. In your experience, have you found that women in your position have to sometimes differentiate their leadership style when they start out in a position before people can quote unquote trust you?
Mm-hmm. Yeah, absolutely. We're not at the parity level yet. Um, and there's actually a brilliant person named Chamath Palihapitiya, and he has this great quote, and he basically says, half the population of the entire world are made up of women. And people are somehow shocked that this half is as capable as the other half, right? Um, and that's no different in healthcare, even still. I do think that, female leaders, the mentorship opportunities aren't as strong as they should be, and that's a real opportunity for us. But I do think that, kind of up and coming female leaders have to really quickly learn the balance of leaning in and speaking up and the ability to really step back and listen to their staff and their departments. That listening ability is critical. Um, I think female leaders have a tendency to do that better. And I think it's because you've had to in order to keep rising through the ranks.
That makes total sense. It's because you have to kind of walk on eggshells, like
You do.
Women, people of color. It's like you come, you're in the room, and then you have to kind of scope things out. You can't just run in there like a bull in a china shop, basically.
Exactly.
Unfortunately. I mean, I don't think anyone should, but it's definitely a different game than it is for men, for sure.
Absolutely.
Yeah. Last question. What is one thing that you absolutely love about your job?
I think honestly, the ability to identify a problem followed by the ability to effectuate change. And all of it centers around how can we deliver better value to patients and families. Um, as healthcare keeps going, as we continue to experience decreases in reimbursement, we're going to have to continue to keep digging and digging and finding where are those areas of opportunity. How do we effectuate that change? And how do we do it without sacrificing quality and safety? That's probably the best part. And when you have even some of those small wins, that's what keeps you going.
Great. I think that's an awesome note to end on. Thank you so much for joining us, Claudine.
Thank you, Kristen.
Thank you all for holding us down, in the hospitals and the ORs. I just appreciate healthcare workers immensely.